Hello everyone, today we have another interesting topic because it's about, I call it the dilemma. Should we save a tooth? How do we know we should save a tooth or we recommend extraction to our patient? How do you know as a patient that it's better for you to extract your tooth or to save it? Is it better for you to keep the tooth? If you look here to the screen in the computer, I have a lecture dedicated to this topic because sometimes it's very difficult, and it's very difficult to make a decision. Why? Because if we have a tooth that is compromised, let's say the crown here is not really affected, okay? I'm talking about all the structure. This is destroyed, but still this is something that can be placed with a build-up here and a crown after a root canal treatment. However, if we have a treatment like my patient, when my patient came and have a root canal, and I remember this patient from also from graduated program where we finished a root canal and 2, 3 weeks, 4 weeks, the patient continued having pain. We suspect about the crack from the very beginning. We told the patient CT scans that we use, like you see it on the back on the screen, they are used to give us the information of the teeth in slides. The technology today is amazing because you can see the tooth in slides, like if they're cutting it side by side, or you can go from horizontal way and you can see every single space of the tooth, and you can see if there's a line of crack, which is very difficult to see, or a fracture that most likely we will see it on the x-ray. But this case was a little challenging because the root canal looks really good. If you look at the screen here, the root canal looks really good. However, the infections were long and the pain on the patient did not stop. And that was my biggest concern because the pain after a root canal is not normal. Either still is some bacteria inside, or the patient is grinding and is touching the tooth. Something is creating a problem in the tooth. So it's important that your dentist listen to your complaints very careful. So if we have to talk to the patient, if we need an implant or we recommend an implant, who is gonna do the implant for that patient? The person who will do the implant, periodontist or neurosurgeon, has to be in close contact with your dentist. So as we talked in the last episodes about how the specialists have to talk to your dentist, this is the same. Because if the dentist said, I can do a removable or partial denture because the patient doesn't want an implant, then we have to go and talk to the patient about the finances, as you see on the screen here. And this tooth was diagnosed later that was cracked and it was extracted. But then you have to talk to the patient in advance. What the patient can do financially? Is he gonna be able to have an implant, like this? Once they take your tooth out, this is what happens. So that's why I don't believe in and go running and have an implant in a minute. This is something that has to be planned by your prosthodontist, by your dentist, and make it a really good decision about if we're gonna extract this tooth, what is gonna be instead of that tooth. If it's gonna be an implant, why is the bite is gonna be taken care of, the patient is not gonna have any problem, so the implant can last for a long time because implants of today are very predictable. However, it's always better to save your tooth because once you take the tooth out, you have the space. Nowadays, they fill out the space with bone. After the 3 months, it's like having a baby. You have to wait for the bone to grow, and then we put the implant. I don't do implants. I love my specialty. This is for another specialist. And then we have to wait until the bone is gonna be attached to your implant. So this is a matter of osteo. It's called osseointegration because it's the bone that is gonna be integrated with the implant. Now, what do they do after? They put an abutment. Is called this gold part. It's an abutment that is on top of the implant, and after that, they will place either separate crowns. If let's say I'm gonna tell you quickly this. They're gonna put separate crowns, okay? My models are jumping along. Let's say the patient said, I don't have the money for an implant. Please take my tooth out and put a bridge. What is a fixed partial denture? Well, a fixed partial denture means that the patient is gonna have a bridge and no tooth, no implant, and your teeth are gonna be looking like this. You're not gonna have this tooth, but I tell you what is the problem. When you are chewing, this poor thing is gonna be doing, these two teeth are gonna be doing the job of this tooth. This is not a big deal because it's a premolar, but when it's a molar, you need more strength. So it's very important that you save your teeth in case you don't want to have an implant or you don't have the finances to get an implant. You can always get a fixed bridge. So in this case, we have to make a decision that the patient has to extract the tooth. And what is next? Because the test is very simple, but the answers is the one that you have to come up with different options that are gonna suit that patient needs, and the patient is gonna have a good prognosis on the treatment and a good long prognosis on any restoration or treatments they're gonna do on that patient. And now we have the opposite. We have this patient, if you look at the screen, where we're gonna call him Mr. Tim, where he had a big infection, but he has a post in here, and we have to remove it to irrigate and wash the area, to disinfect the area. Then we have to remove the post. We did it successfully. Once we remove everything, the garapercha, the material inside, and the post, we finish the root canal again, perfectly clean, and the patient was able, in this case, to save the tooth. After this appointment, he was going back to his dentist to have his treatment, and the patient was here in 2013, and as of today, our patient still is doing well. So it is two cases: one that you have to extract the tooth if it's a crack, or there's no enough tooth structure to restore the tooth, to rebuild the tooth, then you have to really have extraction and your implant. And if it's savable, like in this case, the best thing to do is to save your teeth. So if you have any questions, any comments, don't forget to give us a note on our program, YouTube, Dr. Fanny Yackerman, Instagram or TikTok. Thank you.